Acute attack of chloroquine-sensitive malaria. The tablet chloroquine phosphate 250 mg, which contains 150 mg of base. Give 4 tablets and 2 tablets after 8 hours and 1 tablet BD for 2 days. Patients who cannot take orally 3.5 mg per kg intramuscularly every 6 hours for 3 days. Tablet primaquine 15 mg OD for once a day for 14 days in Plasmodium vivax or Plasmodium ovale. Primaquine 45 mg single dose for falciparum after chloroquine, which is gematocidal. Then patients who can take orally 3 tablets of promethamine and sulfadoxine single dose followed by quinine 600 mg thrice a day for 2 days, or tablet quinine 600 mg TDSX for 3 days with capsule doxycycline 100 mg twice a day for 7 days, or quinine 3 days with mefloquinone or atrovaquinone 250 mg and proguanil 100 mg 4 tablet, which is single dose forms for 3 days, or artesunate 100 mg twice a day for 3 days with sulfadoxine, primethamine or mefloquine. Patients who cannot take orally, injection quinine 8-cell 20 mg per kg in 500 ml dextrose saline over 4 hours, then 10 mg per kg in dextrose saline over 2 hours every 8 hours till patient is able to swallow. Then quinine 600 mg TDS for 7 days and tetracycline or doxycycline or artemether or arteether injection. These are all the doses or prophylaxis details which is given in for chemotherapeutic action. You guys don't need to remember all these things. After completing this anti-malarial drugs, I will just go through a revise which you have to read or which you have to not, as there no specification in question like in your question bank, no question is there from anti-malarial drugs. That's why I just giving you very elaborately, elaborately, but you guys don't not need to all these things. When should resistance be suspected? All patients with complications. Any patients who has already received chloroquine last 1 month and hemoglobin continues to fall in absence of bleeding and asexual forms persist along with symptoms after 48 hours of treatment. These are severe and complicated falciparum malaria, hyperparasitemia, hyperpyrexia, fluid electrolyte disturbances, acidosis, hypoglycemia, cardiovascular collapse, jaundice, severe anemia, spontaneous bleeding, pulmonary edema, renal failure, hemoglobinuria, black water fever, and cerebral malaria. So these are severe and complicated falciparum malaria. What the indication is happening for complicated falciparum malaria? So these are all the symptoms and complications.